Imagine waking up one morning and realizing that the simple act of standing up feels harder than it used to. Your knees ache, your steps feel slower, and climbing the stairs suddenly seems like a challenge. For many people over 70, this scenario is all too familiar. Knee pain in older adults is one of the most common and frustrating health issues that can slowly steal mobility, independence, and confidence. While it's often seen as an unavoidable part of getting older, the truth is that knee pain doesn't have to define your golden years. With the right knowledge, care, and treatment, it's possible to manage the discomfort, stay active, and continue doing the things you love well into your 70s and beyond. As we age, our bodies go through natural changes that affect every joint. But the knees take the hardest hit. They carry the body's weight with every step, bend and twist, and over time, that constant pressure leads to wear and tear. The soft cartilage that cushions the bones begins to thin out, and the smooth gliding motion of the knee joint can turn into painful friction. For many seniors, this gradual breakdown results in stiffness, swelling, and aching that make everyday movements uncomfortable. Something as simple as walking to the mailbox or getting up from a chair can become a painful ordeal, but understanding why this happens is the first step toward finding real relief. The leading cause of knee pain in people over 70 is osteoarthritis, a degenerative joint disease that affects millions of older adults worldwide. Osteoarthritis occurs when the protective cartilage inside the knee joint wears away, leaving the bones to rub directly against each other. This friction leads to inflammation, pain, and swelling, which often worsen with activity. Over time, the joint may lose flexibility, and a grinding or popping sensation might develop when bending the knee. However, osteoarthritis isn't the only culprit behind knee pain in seniors. Other conditions, such as rheumatoid arthritis, gout, bursitis, and past injuries, can also cause persistent knee discomfort. Rheumatoid arthritis is an autoimmune disease that attacks the lining of the joints, leading to chronic inflammation. Gout results from a buildup of uric acid crystals, which can cause sudden severe knee pain and redness. Bursitis occurs when the small fluid-filled sacs that cushion the knee become irritated or infected. Old sports injuries, fractures, or ligament tears that never fully healed can also resurface later in life, causing renewed pain and weakness. In addition to these medical causes, lifestyle and physical factors often contribute to knee pain in older adults. Years of walking, climbing, and lifting can take a toll on the joints, especially if posture or gait isn't ideal. Weak muscles around the knees can reduce support and stability, increasing the strain on the joint itself. Carrying extra body weight compounds the problem. Every additional pound adds several pounds of pressure on the knees with each step. That's why obesity is one of the biggest risk factors for developing or worsening knee pain in the elderly. The good news is that identifying the root cause and taking early action can make a remarkable difference. Treatment for knee pain in people over 70 should always begin with a proper diagnosis from a healthcare professional. Self-diagnosis can be misleading, as different conditions can cause similar symptoms. A doctor will typically start with a physical exam to assess swelling, tenderness, and range of motion. Imaging tests such as X-rays or MRI scans can reveal cartilage loss, bone spurs, or other structural problems inside the knee. Once the underlying cause is identified, a personalized treatment plan can be developed based on the individual's level of activity, overall health, and the severity of the condition. For most seniors, non-surgical treatments are the first and often the most effective option. One of the most beneficial approaches is physical therapy, guided by a trained therapist. Gentle and targeted exercises can strengthen the muscles surrounding the knee, especially the quadriceps and hamstrings, which helps take pressure off the joint itself. Stronger muscles mean better support, improved stability, and less pain during movement. Physical therapy also includes stretching routines to increase flexibility, which can ease stiffness and improve mobility. In addition to physical therapy, low-impact exercises such as swimming, cycling, and walking on flat surfaces can keep the joints active without putting too much strain on them. These activities promote circulation, reduce stiffness, and help maintain a healthy weight, all crucial for managing knee pain in older adults. The key is consistency and moderation. Overexertion can make the pain worse, while gentle, regular movement can gradually improve joint function. Pain relief is another important part of treatment. Over-the-counter medications like acetaminophen or non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, can help manage mild to moderate pain. However, older adults should always use these medications under medical supervision to avoid side effects, especially if they have heart, kidney, or digestive issues. In cases of more severe pain, doctors may recommend stronger prescription medications or joint injections. Corticosteroid injections can provide several months of relief by reducing inflammation, while hyaluronic acid injections act as a lubricant that helps the joint move more smoothly. Lifestyle adjustments play a major role in managing knee pain for seniors as well. Maintaining a healthy weight can dramatically reduce pressure on the knees, making movement less painful. A diet rich in anti-inflammatory foods like fatty fish, leafy greens, berries, and nuts can also help reduce inflammation naturally. Staying hydrated, avoiding processed foods, and ensuring adequate intake of vitamins D and K support bone and joint health. For added comfort and stability, assistive devices can be helpful. Knee braces, walking canes, or walkers distribute body weight more evenly and take stress off painful joints. Proper footwear is equally important. Shoes with cushioned soles and good arch support can absorb shock and improve balance. Simple home adjustments, such as installing grab bars in the bathroom or using a raised toilet seat, can make daily tasks easier and safer. When conservative treatments fail to provide relief and the pain becomes disabling, surgical options may be considered. Total knee replacement is a common procedure for severe arthritis and has an excellent success rate, even in patients over 70. Modern surgical techniques and improved rehabilitation programs allow most seniors to regain mobility, reduce pain, and return to normal activities within a few months. However, surgery is a major decision and should only be pursued after thorough discussion with a healthcare provider. Living with knee pain doesn't mean giving up the activities and independence you value. With a balanced approach that includes physical therapy, exercise, weight management, and professional medical care, seniors can experience significant improvement in both pain levels and quality of life. The most important step is not to ignore the symptoms or assume they're just part of aging. Early treatment can slow the progression of joint damage and keep the knees stronger for longer. Knee pain may be common among people over 70, but it is not unbeatable. By combining modern medical treatments with healthy lifestyle habits and proactive self-care, it's possible to reclaim comfort, mobility, and freedom of movement. The golden years can still be active, fulfilling, and pain-free. With the right attention, patience, and care, your knees can carry you confidently through every moment that matters. A physical therapist can guide seniors through safe movements that improve flexibility, balance, and coordination. Low-impact exercises like swimming, cycling, and walking on flat surfaces can also help reduce stiffness while keeping the knees active without excessive strain. Stretching is equally important, as tight muscles can worsen joint pain and limit movement. Pain management plays a central role in treatment, and it usually involves both medication and lifestyle adjustments. Over-the-counter pain relievers such as acetaminophen or non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, can help control mild pain and inflammation. However, these should always be used under medical supervision, as older adults are more susceptible to side effects, especially if they have heart, kidney, or stomach issues. For more severe pain, doctors may prescribe stronger medications, topical creams, or corticosteroid injections to provide longer-lasting relief. Some patients also benefit from hyaluronic acid injections, which act as a lubricant to help the joint move more smoothly. In addition to medication, lifestyle changes can make a significant difference. Maintaining a healthy weight is one of the best ways to reduce knee pain. Every extra pound of body weight puts additional stress on the knees, so even modest weight loss can lead to noticeable improvement. A balanced diet rich in anti-inflammatory foods such as fish, leafy greens, berries, and nuts can help manage chronic inflammation that contributes to joint pain. Staying hydrated and avoiding excessive consumption of processed foods and sugars also supports overall joint health. Assistive devices can also be a valuable part of treatment for knee pain in people over 70. Canes, walkers, and knee braces help reduce pressure on the affected joints and make walking safer and more comfortable. wearing supportive shoes with cushioned soles, and good arch support can also ease discomfort during daily activities. Sometimes home modifications like adding handrails, using raised toilet seats, or installing grab bars in the shower can prevent falls and reduce strain on painful knees. When conservative treatments are not enough, other medical procedures may be considered. Corticosteroid injections can provide temporary relief for several months, while hyaluronic acid injections may help improve joint lubrication and flexibility. In more advanced cases, where the cartilage damage is severe and mobility is significantly affected, surgical options may be recommended. The most common surgery for chronic knee pain in older adults is total knee replacement. During this procedure, the damaged joint surfaces are replaced with artificial components that restore smooth movement and reduce pain. Although surgery may sound intimidating, knee replacements are now considered highly successful procedures, even in patients over 70, with most people experiencing significant improvements in pain and function after recovery. Recovery after knee surgery requires patience, physical therapy, and gradual strengthening. It's crucial for seniors to follow their rehabilitation plan closely to regain mobility and avoid stiffness. Many patients are able to return to their favorite activities, such as gardening, walking, or light exercise once healing is complete. The success of surgery often depends on pre-existing health conditions, muscle strength, and adherence to post-operative care instructions. For those who prefer non-surgical or holistic options, alternative treatments can also play a helpful role. Acupuncture, massage therapy, and chiropractic care have been reported to reduce discomfort for some people. Heat and cold therapy can be used at home to soothe sore joints. Heat improves blood flow and relaxes muscles, while cold packs help reduce inflammation and swelling. Some seniors find relief with natural supplements like glucosamine, chondroitin, turmeric, or omega-3 fatty acids, though it's important to consult a doctor before starting any supplement to ensure safety and avoid interactions with other medications. Emotional well-being is another important aspect of managing knee pain. Chronic pain can lead to frustration, depression, or anxiety, especially if it limits daily activities or independence. Staying socially engaged, maintaining a positive mindset, and participating in gentle physical activities can improve both physical and mental health. Group exercise classes, designed for seniors, such as water aerobics or chair yoga, provide both social interaction and safe movement opportunities. Preventing further knee damage is just as important as treating existing pain. Seniors should avoid high-impact activities that put too much stress on the joints, such as running or jumping. Instead, they should focus on maintaining joint flexibility and strength through safe, controlled movements. Using proper posture when walking, standing, or lifting objects can help prevent unnecessary strain. Regular checkups with healthcare providers allow for early detection of worsening arthritis or other conditions so that treatment can be adjusted promptly. Technology and medical research continue to advance, offering new hope for seniors struggling with knee pain. Modern regenerative medicine techniques, such as platelet-rich plasma, PRP therapy, or stem cell injections, are being studied for their potential to help repair damaged tissue and reduce inflammation. While these treatments are still being evaluated and may not be suitable for everyone, they represent promising future options for those who wish to avoid surgery. Ultimately, the goal of treating knee pain in people over 70 is to restore mobility, reduce discomfort, and improve overall quality of life. With the right combination of medical care, exercise, diet, and support, many seniors can continue to lead active, fulfilling lives. Taking knee pain seriously and addressing it early can prevent it from becoming disabling. A proactive approach that includes regular physical activity, proper nutrition, and professional guidance is the most effective way to maintain healthy joints well into the later years of life. Living with knee pain does not have to mean giving up independence or the activities one enjoys. Many older adults discover that small, consistent changes in their daily routines lead to big improvements over time. Whether it's joining a low-impact exercise class, eating a more balanced diet, using a supportive brace, or consulting with a doctor about treatment options, every step taken toward better joint health can make a difference. You're walking through your favorite park, enjoying the sunshine when suddenly a sharp ache shoots through your knee. You pause, rub it a little, and tell yourself, it's just old age. But what if that pain isn't something you have to accept? What if, instead of slowing down, you could take steps to feel stronger and move freely again? The truth is, knee pain in people over 70 is common, but it's not something you should ignore or simply live with far too often. Seniors dismiss joint pain as an inevitable part of aging. But in reality, it's a sign that your body is asking for care. The knees are hardworking joints that bear your weight every day. And over the years, they can develop wear and tear from arthritis, old injuries, or muscle weakness. Ignoring the discomfort can make it worse, leading to stiffness, reduced mobility, and even loss of independence. The key is recognizing that knee pain is treatable, and with the right approach, you can regain comfort and confidence. Addressing knee pain with a combination of professional guidance, exercise, and lifestyle changes can make a life-changing difference. Physical therapy strengthens the muscles around the joint, while low-impact activities like swimming and walking keep the knees flexible. Maintaining a healthy weight reduces strain, and balanced nutrition supports joint health. Medical treatments, from simple anti-inflammatory medications to advanced therapies, can also provide real relief. The goal isn't just to stop the pain, it's to stay active, confident, and in control of your life. With care, persistence, and the right knowledge, you can keep moving through your golden years with strength and freedom. Knee pain may be common after 70, but it doesn't have to define your future.